was changed specifically for county board supervisors and is now, I know, is being reconsidered perhaps specifically for county board versus other boards and commissions. So we will continue to follow those rules to the extent that we can, but I appreciate you bringing it up. If we were in a gray area on forum for today, we probably would have called for council.
Okay.
The next item, request to waive a 2-year limit on project employees for communicable disease response.
Thank you. As a part of a COVID response last year, we brought forth a very similar request. Currently, we're able to hire employees, and I'm just going to give extra background to the people to the county here. We have a table of organization with officially approved positions. In addition to those officially approved positions, they either go to budget or go through a process of committee P and at the county board. We have temporary positions, project positions, and casual call positions. Those are all three classifications that departments can utilize to hire staff for non-permanent assignments. Temporary employees have a maximum of length of employment of 6 months. Project employees are set at 2 years. Casual call employees are fairly indefinite, and it's a special classification for when we just have very intermittent work or undefined hours. The part of the intent of a limitation on a project employee for 2 years is such that we don't just hire people as temps and not have them go through a process of improving them. It's also such that these employees do not earn seniority. And so there is an expectation that if we're going to have an employee, in normal times for beyond 2 years, that we're going to treat them like a regular employee and they're going to have the full benefits and considerations of a regular employee. So it's been protective for the individual, and we don't necessarily abuse putting people to work because we can do it without going to the board. Last year, we asked for a waiver of the 2-year limit for project employees because the pandemic was going on so long, and we were utilizing our grant funding to employ these persons. We had a very small number of individuals that were with us from the beginning of the pandemic that were reaching that 2-year limit or would be reaching that 2-year limit, and we did not want to end their assignments. We also didn't anticipate making them regular employees because we're using grant funding to support our response to COVID. That was approved, but it was amended, and it was only allowed to exist until the end of this year. If we project forward through January with the current staff that we have right now, we'll have up to 4 through January that we would have to potentially say goodbye to, that have been a significant asset to this department in our response for communicable diseases. And I'm broadening this to communicable disease because of monkeypox. We have another crisis on the horizon here. Don't know how much effort that it's going to take to continue to respond to that. We certainly hope that our work right now on the front end of this, not only here in Winnebago County, but collectively in the Fox Valley, will help reduce the likelihood that we'll be able to contain monkeypox here and not have the outbreaks that we're seeing in other areas of the country. So with that, we may be utilizing these staff not only for COVID, but also for monkeypox response. And so I'm asking the board to support, again, waiving the rules of a 2-year limit on a project employee so that we can retain them and the experience that they have gained here to continue to respond to our communicable disease crises. This is This is still grant funding. We're not trying to, replace regular positions with project positions. This is all in the name of the response to, the current disease threats that we have. And so what I would ask for you to do is to waive the 2-year limit on project employees with communicable disease response. If you want to put a time limit on that, you can. At this point, we don't know what's going to happen in the future. And so if you're comfortable not having a time limit on that, that would avoid us having to come back again to do this if we find ourselves in the same situation within that time limit again.
1 or 2 questions. You said this is a grant funded position. You don't.
Positions.
Position, sorry. Am I taken for that? You don't know how long this grant will last still? Is that?
Well, we have COVID funding into 2024. And I don't know if monkeypox will result in additional funding or not. But certainly through 23, I mean, we have grant funding.
Because I can see now, you probably don't know, that do other departments, they had asked for a waiver for project positions, you know?
Not every organization operates by the same rules. And so I think, the rules that our HR department has or our county has related to table of organization and different types of employee classifications isn't consistent.
So do you know anyone, my question was, any other department within this county, has they use this waiver for project position, or do you don't know, or do you don't know, that you care?
I can tell you that the other departments are continuing to use additional non-regular staff to help respond to the pandemic yet. And how they're structured and how they do that, I don't know.
Because I can see them saying, well, if we do it for you, health department will have to do it for other departments, and I'm just.
Yes, and I understand that. We're asking us specifically for the communicable disease response. That's where we're trying to be very targeted with this.
Okay.
So Mike, I think you're asking if there's precedent.
What?
Are you asking if there's precedent for doing this from other departments? Because.
Especially, and when I'm trying to get within this county, especially in this county, because I can see you, one member of PNS bringing up, well, we let, like as I said, if I let you do it in the health department, what if the highway department asks for this, or
So,
human services? That's what I'm trying to get at.
so in the past, not related to COVID, I think it was the sheriff's department.
Okay, all right.
Had asked for an extension on their project employees, and when we first brought this up for our department, we actually used that example. But that was pre-COVID.
Well, that's
But
a very good example. That's what I'm trying to look for, because if on the board floor and being up, the people say, hey, like I said, I can bring up, well, other departments do listen, okay, that's very helpful.
so
Thank
to my knowledge, I think it was the sheriff's department. There could be others, but when I asked HR for an example, that's the one.
I mean, the alternative, I guess just to weigh this out, the alternative or the consequences are, if we don't allow project employees to extend beyond that 2-year limit, we have to end their relationship with the county, or we hire them as a regular employee. And so that would be, that's what we would do. We would come back and ask for a change to the table of organizations and add them on as a regular employee for, what really is just hopefully a time limited response that, we don't see that we have funding that will perpetuate into the future such that it makes sense to make these regular positions, which is why we're asking to extend this project.
How long does the current funding, what you said, through 2024 or?
So right now, mid 2024 would be the limit of use of the funding that we have right now. I don't know what may be coming yet.
I'm sorry, I missed the
Middle of 24.
middle, okay.
Yeah, June 30,
Yeah,
2024.
I got some questions. So is this a financial question for this
No.
right now?
It's not, it's really just a question of waiving the rules that limit project employees to 2 years. There's really no financial consequence to this, as we're, utilizing, existing grant funding to have them, and it really, we'll only have them as long as we need them, but right now we need them.
And waiving the rules, whose rules are they?
So these are rules of the personnel, probably, I mean, I guess our HR department. And I did bring to question whether or not this is a board decision or an administrative decision. That should be made by the county executive and HR director. There's precedent set that we brought this last year, and this is the process that it was done through. So it may be deemed that once this goes to the Personnel and Finance Committee, that, it doesn't have to go any further. Last time, I believe it did go to the full county board. I think there's some confusion as to what's necessary in terms of approvals to approve this, that it was just safer to take it through the full county board process.
And this isn't just a governmental issue. I mean, this is to protect both the resource as well as the hiring body, right? And this goes back to lawsuits 10 years ago when people thought they were owed benefits because they were a temporary employee at Facebook or Google for 5-10 years, and then they sued. So has corporate counsel chimed in on this recommendation?
So we have had discussions with corp counsel about this, and at this point, this is the recommendation that we received to do this. So, and so the hazard to this would be, let's say, one of the 3 or 4 people that are impacted by this, we have an opening in our department, let's say a regular position, and then we hire that person on as a regular employee. They will lose all the seniority from being a project employee because it just doesn't count. And, we're very clear, in hiring, they receive other benefits. I mean, if they're a full-time project employee, they receive the full benefit package, but they don't get seniority. If they're a part-time, they receive part-time benefits, but they don't accrue seniority in terms of, at 5 years, now you get an extra week of vacation. That's what. And I don't know how it works for vesting. They do get, Wisconsin retirement system entry. I'm not clear on how that works. My guess is that time would count for vesting, but I'm not entirely sure.
And I don't know if this helps, but the 3 or 4 project employees that we're talking about, except for one, are not interested in full-time position. They are very content with working part-time. They are our most seasoned project employees, work very independently with very little hand-holding on our part. So it really helps us as permanent employees to just be able to continue to do our work with a lot of confidence that these seasoned project employees are doing a great job.
And part of this is we have the funding for that has been supplied to help us respond to the pandemic. Utilizing those funds to hire additional staff to support us allows our regular staff to focus, on pre-pandemic issues and post-pandemic and recovery issues.
And one other question that I thought of that we may all get. Who decides that they're being used for communicable disease? Who versus something else?
Oh, well, we do. I mean, we specifically hire them for, this work. And as a part of this, in order for us to be reimbursed for their work, is all of our grants all come to us as, there's this amount of funding available. You need to show us that you spent it before you can get it back. So a reimbursement-based grant. We record their time in 15-minute increments of what they're spending their time on. And they code that time. And we record that for audits and for billing of our grants and others. And that's all, information that's contributed.
We need a motion.
Yeah, there isn't a form for this or anything, so it's really, I'm presenting this as, as an ask to waive those rules, and we'll forward this on to personnel and finance.
I'll make a motion, Madam Chairman, to approve the request to waive the 2-year limit on project employees for communicable disease.
Is there a second?
Second.
All those in favor, vote aye.
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 Those not in favor, vote nay.
I just want to be sure there was no discussion or an interest in amending it, that's all before.
I'm sorry, who seconded? Thank you. I heard a voice, but I wasn't.
If you're good with it as is, we're good. I just wanted, once we seconded it, I just wanted to make sure there's no more discussion or interest in amendment.
Well, yeah, I'm sorry, 'cause, yeah.
Hey, it's kind of-
discussion on the side. So, what are we approving? And now is this forever? And it's just for communicable diseases until the funding runs out? I mean, these are all important questions to ask, because this, as we voted, it's forever. And for anything communicable disease, as long as there's money to pay these contractors. So and is that something we want? That's a change in the rule.
Is it too late to amend?
No, you can motion to reconsider.
So. Well, here's my question. If the question is waived, oh, I get it. So. I get it, okay, so, yeah, I was thinking, I was reading too much, and I think, if the waiver is for 2 years, and it's only for 2 years, and after 2 years, you have to do another one, but, yeah. But it's just a position, you would have to do that because the waiver.
We're either at or approaching a 2-year limit in the next several months for some of the employees that work for us. And we just want to be able to continue their appointment as a project employee beyond that time. And that's mutually agreeable, right? I mean, the employee has to agree to that, well.
Correct.
And one last question, and I maybe have heard you wrong, but I thought last year we asked for 2 years.
No, last year we asked for the same thing, and it was amended at PNF, I think, with a limitation of the end of this year. So in other words, we would waive the 2-year limit until December 31st of 2022. And so it was limited at the next committee.
So I would really like to add a time limit of the middle of 2024.
Is there, any that's not a time limit? What if we said, the limited, whenever funding runs out, we just runs out?
Well,
Too general,
It gets pretty
broad?
complicated. What funding, grant
Yeah.
funding, levy funding?
Grant fund, I think, I mean, all I have, yeah, okay.
We probably should, because PNF will do it anyway.
Okay, I mean,
Right,
right, I mean, I'm just,
we might do it now.
I mean, I'd say 100%.
That's okay.
So I heard June 2024.
Motion to change it to put a limit. I'm making sure this is what we want. To project employees. And then do we have to have a grant in there because there's unlimited
Yeah.
grant?
You know, I think we're setting the limit because you know what the time frame of the grant is.
Was to match the grant.
And that's for COVID. Like I said, I generalize this to communicable disease instead of COVID because we're facing no threats, right? And that's fine. I mean, it's, you know, we're happy to come back again. I mean, I don't know that any of these employees will stick around that long, you know, and every time we hire a project employee, that 2-year, you know, calendar starts over again.
So we want to make a motion to change to put to waive the 2-year limit, but to put a new deadline to 2024. June of 2024.
yeah, I'll do that, yeah. I'll make that motion, I'm sure.
I'll second.
Any discussion on that? Okay, all those in favor say aye.
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 All those not in favor? We will move on to the income statement review.
In your packet is a July 2022 income statement form or PDF. And that is a summary through July, mostly up to date. I don't think the book's closed until a little bit after I ran this report for July. Just to give you a sense of where we're at this year in our budget. the top section again, just for, and I spent a little bit of time on this, just because I want you to really be familiar with how the income statement looks for Winnebago County. I'm sure it looks different than some other organizations that you're affiliated with. And for you to have a chance to ask any questions, and we'll continue to do this at future meetings. Want you to, get your head around our budget. And so that first section, intergovernmental revenue, those are funding sources that are either defined or and other grantor agencies. Medicaid is typically direct service, prenatal care or tuberculosis. We're doing less of that, or finding another way to provide some of those services. So our reimbursements are going down on that. Plus, a lot of that work during the pandemic really went away. Wisconsin Children and Families, that is basically WIC. Wisconsin Health Services is a large number of grants, including our COVID funding. So there's a large number of programs there. And, billing on these, the receipts of expenses from these grants typically lag 2 to 3 months. And so you'll see that, when we look at our intergovernmental revenue here, we're at 31%, even though we're, through July, we're, 58+% through the budget year. But you can see the amount of money that, we're billing per month right now on the very far left column. So, for July, that's how much we bill. And the public services, those are other revenue sources for typically direct services or contracts that we have. The largest two of those is the inspection fees, which is basically all of our inspections, our licensing and inspection programs for food establishments, lodging establishments, swimming pools, campgrounds, tattoo parlors, animal pet grooming establishments, you name it. There's a whole load there. Most of those revenues are in for the year because the license year starts on July 1, and those fees are typically due by July 1. And then the housing authority, we have a contract with the housing authority to provide nursing services, about 1 FTE to the housing authority for all of their campuses. And our public health nursing staff provide that function. Sliding down towards the bottom of page 1, the other significant piece here is transfers in. That's levy. That's and then again, another place for you to look and see at 58.33%. That's 7/12 of the year through July. And so our revenue total is at 44% of what we have budgeted so far this year, which is probably that's pretty good. Because normally outside of levy, the rest of those funds lay. Wages should be pretty much right on, and so that's an indicator of where we're at with budget. So wages, regular wages subtotal 59% versus 58% through the year. Fringe benefits at 50%. So that total labor is at 57%. So we're right on target for labor expenses for this year. The next section is travel, lapsing from page 2 to page 3. We're at 75%. And so a little definitely higher than we've been in the past few years, where we've barely made a dent in our travel budget because we just didn't do any travel. Now that things are opening up, we've got a lot more going on in terms of registrations, some lodging, tuition, that sort of thing. So that is getting back to normal, but probably surging a bit just because we haven't had the activity the past few years.
Do you foresee a budget shortfall before the end of the year?
I do
You're
not.
at 75%.
I do not. If we need to transfer some funds, we'll come back to you, from another category.
Okay.
I suspect this year, we will be putting a sizable amount in the reserve again. Just because we've had, we've utilized a lot of grant funding that has offset our regular work. It's less than in past years because we're getting back to our regular work. But, you know, the funding that's been flowing from the feds for COVID response has helped the bottom line tremendously here.
Does that go into the reserve fund for the health or the common for health? And can we use for health department related thing, correct? That.
It can only be used, it can only be used to offset levy from the participating jurisdictions, which is all of the county except for the city of Nashville, because they have their own health department. So this year, $800,000 of our, and I'm getting ahead of myself here, but $800,000 of our reserve was applied to reduce this year's budget. And we've been asked to do the same for next year, but I'll talk about that in a second. So our operating subtotals, you know, we haven't spent nearly the amount of monies that are available there yet. And a lot of that is a result of funds being available, but really not categorized. When we receive, like for COVID funding, because we're not exactly sure how it's gonna be used, and we bring those monies into the budget to expend, we typically put them in other operating supplies or other contracted services, until we really know how we're gonna use it. And then, see the rest of on the expense side, we're at 44%, and you know, we're 58% through the year, so we're well under budget for the year. If you look at that final bottom blue line, when you read the income statement, you can see that in the third column, you know, our expense total budgeted was 7 million. And right below that in parentheses is 830,000. 830,000 is a projected deficit. Okay, and that is the 800,000 that is coming from reserve. So we projected in this budget to be short 800,000, in this case 830,000, and have that covered by contributions from our reserve. And that was a plan. And that's why that will never, that's not zero unless we're not using our reserve.
And again, so we're using $800,000 of reserve to cover that, right? How much is a reserve now? Can I ask that?
You can ask it. I don't know if I can answer you. I haven't checked lately. I believe we were a bit over 2 million before we came into this year. And then, you know, I'm projecting that we'll certainly be under budget again this year, and so we'll probably contribute to the reserve again. Although the county executive has asked us to apply 800,000 again to the next year's budget. So I'll get you that answer. I think it was a little over 2 million before this year started.
Maybe sometime, and I know it's been important for years, like we're buying fund balance to this year. And somehow that fund balance come back and go back to the reserve of money. And then
If we don't spend it.
It's just, okay, so that,
Yeah.
the same with park crew, I understand that we have this reserve. We maybe use it, but if we're not gonna use it, then we put it back in reserve, and that's.
Yeah,
So
so
I'm, like I say, I'm more used to what they're on, human service board, where at the end of the statement, they'll tell you, is it gonna be a deficit, or we're gonna give back whatever to reserve, that's what I'm used to, so. What I learned yesterday, what I learned today is someone new, and I have to get better understanding, so, thank you.
if you have some suggestions on us presenting this to you differently, I'm happy to hear that. I mean, basically, if we spend all the money that we budgeted to spend, then we'll be applying that full 830,000 from our reserve. If we do not, you know, let's say we spend $200,000 less than we thought we were going to, then that would just remain in the reserve and wouldn't be applied.
What is the reserve fund?
So the reserve, came from, years of any savings that we've had. If we've been under budget, any additional funds left go to that reserve. And so there's a bit of history here. We had a consolidation of health departments, back in 2012. When we combined the Nina, Oshkosh, and county health departments together, we had a reserve fund then, and that reserve fund was, only from funds from the towns. Because Nina and Oshkosh and National all had their own health departments. When we consolidated, we closed that account and we applied those dollars back to the towns to offset their, their allocations towards, our levy. It's to offset what they had to pay, so we refunded that money to the towns. Starting with the new consolidated health department, any funds that were left over at the end of the year went into that reserve fund. So over the past, 10 years, we've built that reserve up. It's had a significant boost since COVID because we had to put all of our resources in the department pretty much towards the COVID response, meaning that we were able to get reimbursed by a grant, from the CDC for that. And so the dollars that we normally would have spent on, for regular, levy activities were offset by that grant. So now we have additional funds than we would normally have in reserve. And now, because that reserve is quite large, we're applying those monies back to our levy to reduce the burden on taxpayers.
So how much would have gone to it this year?
So we budgeted, when we made our budget for this year, we planned 800,000 of the reserve to offset levy. So in other words, when you look at what our levy amount is, that, on page,
No, I know that, but I mean, what money went in there this year? Just went in there. I know you're gonna use 800.
it only closes out at the end of the year.
So whatever it is.
So whatever we're under budget at the end of this year will go into the reserve.
Okay.
And then it'll get then we'll, and then we'll have a new reserve balance. Although we're already planning, or at least the county executive is already planning to apply 800,000 of our reserve to next year's budget.
We're gonna have 16 years down to 400,000, if it's 2 million. We'll be right?
Potentially, yeah, but I don't think we'll probably spend, all of it this year. So we try to maintain a reasonable balance for, for crisis situations, or other unanticipated expenses. Just like, we have a general fund, and because we don't serve the full county, we end up with our own reserve. And then that's just for accounting purposes. It keeps it cleaner, for the county. Any transfers out of that reserve fund, you have to approve. Unless it's a part of budget, and then you approve it as part of the budget process. Fortunately, with COVID, if COVID only happened in Winnebago County, we wouldn't have had the state and federal response and funds available. And we would have had to probably rely more on our reserve fund to respond. In this case, we didn't. And so now we've been able to use federal funds to really offset our local funds, which I don't think is really the intent, but it's just how it happened. We just didn't have the staffing to respond to the pandemic separately from our regular operations. So that's just a review for you. I'm happy to answer any additional questions you have, or set up a time to review in more detail with you, if you would like to get a more detailed view of the budget.
The budget planning update.
Also in your packet is a 2023 department level budget to CEX, or county executive. What that is we were given targets to set for our budget for next year. We were given a levy limit to meet, and we were asked to maintain our budget flat compared to last year. Of course, included in that is an anticipated 4% increase in wages. And then any other operational changes that we would make. And so we basically are trying to eat that 4% increase in wages, which is obviously the largest portion of our budget by far, in presenting a flat budget to the county executive. County executive has also asked us to identify any add-ons that we would like to have in our budget. In other words, things that we would like to do, but we didn't have room in this budget to do. And during the month of August, county departments meet with the county executive, the finance director, the HR director, to review the submitted budget and make any alterations to that. After that meeting, the department budget becomes the county executive budget. And then that budget will get presented to you. And you will ultimately vote on that at the end of October, beginning of November. At which point that'll become the adopted budget for next year. So we'll be meeting next week with the county executive on this budget that we've presented to you here. And we'll have a discussion about any modifications that, we have with new information, like the grant that you just approved today, the budget transfer you just approved today. We'll add in the additional funds for that into next year's budget. We've got a number of other minor adjustments to make as we find out more about, different funding sources. We have a fairly complex budget because we have so many different funding sources. And we make our best guess when, in July, when we have to submit this, about what we're gonna have for all of 2023. And so we'll update that as much as we can. And then discuss any other changes or add-ons. We do have a request for an add-on position to manage our harm reduction program. So we'll have a discussion about that. Hopefully that'll be an easy discussion because, for the first year or so, we actually have the funding from another source to pay for that. So hopefully it'd be a minimal levy impact. But basically the add-ons are things that are gonna have levy impact. And at this point, there's additional funds from net new construction. And there may be other available funds through just what's gonna be allocated to municipalities that can be prioritized for use in next year's budget. County executive may decide, also how to use any of the general reserve funds, or in this case, our reserve fund, and we'll certainly discuss that as well. But the expectation that was presented to us was for us to use a big chunk of the reserve again this year to reduce our levy and then the impact to taxpayers. This is set up pretty much like the income statement, where you can see our revenue sources on top, what we expect to receive for revenues from the various funding organizations that we work with, or grantor agencies that we work with, or contractor agencies. The second section, anticipated direct service revenues, again, largely dominated by licensing and contract housing authority. And then, anticipated best guess expenses, for labor, travel, and really we've tried to, obviously we've made this flat as much as we can. We want it to be accurate, but it's budgeting has become a little more difficult the last few years, just because our operations have been, not consistent because of the pandemic response. Anyways, this will become the county executive's budget after we adopt it. There isn't a review and approval process at the jurisdictional level for budget, but I want you to know what we're putting forward, and so that you can ask any questions about it or advocate for changes if you'd like to see them. Clearly, there's an opportunity at the end of October and beginning of November when you review this budget to offer amendments or try to support our funding in the other way.
My two questions, is could Rachel, you or Ralph, sit on that meeting, because we are entitled to one board member to be present at that meeting.
You are.
And then, if you can, I would appreciate it. Will we be meeting as a whole board after, obviously it'd be after you have your meeting with the contractor, but before we meet at the budget time to the last week in October.
Yes.
Who
Yeah, I mean, we'll decide at the end of this meeting when the Board of Health will meet again, but it's August. We won't go past October, mid-October before we meet again.
Because at that time, I would think, I would like to, the one add-on you said, but if we either as a board or I, as an individual supervisor, would like to make an amendment, I would like to get more informed about that position all entails, so that's why.
Yeah, I have no idea how that discussion's gonna go yet. I will give you an update after we meet with the county executive, and then you'll see the result of that, because that'll be the budget that's presented to you to vote on at the county board. Now, Toby, I mean, citizen involved members don't have the opportunity to actually vote or make amendments on that budget, but you are more than welcome to offer, input at those budget hearings.
And it is my understanding, I've been wondering that capital requests for help are separate, right, from your budget. Do you have any capital requests? No.
No, the only, we had one capital request for this year, and that was to replace a vehicle. But given the price of vehicles and the usage of vehicles that has shifted in the last year or two, we're just gonna hold on that and carry that into next year. So what we'll do is we'll ask for a carryover in March when the carryovers are done, to potentially replace one of our vehicles next year, but that's all we have.
No, thank you.
Just to answer that, I think I was invited on Wednesday to that meeting you talked. I'm going to that for health board and for the human services. So I'm gonna be there, so you don't have, go what you want to. Go on anyway. I don't- Okay.
Yeah, I'll give you the detail on that. The 24th at 11:30, right, so we're meeting in the county executive conference.
Well,
I just had a high level question, because I'm not quite sure what jurisdiction we have it. You said you've been asked to make sure that the budget's flat for next year. And there's an expectation that there's a 4% wage increase. And then you said you had to eat the 4%. So what area is getting 4% less?
Yeah, well, it's operating costs. I mean, I'd have to do the math here, but with COVID, our budget's a little bit more skewed. Normally, we're about 85% labor and 15% other expenses. So that includes, travel, all of our supplies, other operating expenses. With COVID and having additional funding, that's been skewed a bit. But it still is gonna come from other operations. And it's tough to pin down exactly where that 4% is coming from, because our funding, our non-levy funding sources are highly variable. So we may be, the grant that, that we just approved for transportation, a portion of that is gonna support some of our positions. And there's other grants that we may have for next year or have now that are helping to offset some of our labor costs. And so it's through the combination of those other funding sources that, we find a way to keep the current workforce employed through a combination of grant and levy funds. And I wish I could state that more simply. It's just, it's an ever-changing situation with what we have accessible to us for contracted grant funds. So, a forecast for the future, it's the pandemic has really highlighted how public health infrastructure has degraded, over the past couple of decades, how funding for public health has declined, how we don't have and didn't have the capacity to really adequately respond to the pandemic. And so we're anticipating that we're gonna see, the knee-jerk reaction from the federal level, right? Every time we have a crisis, we're likely to see additional funding come to public health to help build capacity and infrastructure, workforce capacity and infrastructure. What that looks like, I don't know yet, but I mean, I've already had discussions with the county executive about, you know, if we project ahead a few years here, you know, what's gonna happen with our workforce? What kind of space needs do we have? What kind of policies do we want to consider related to that? And, you know, how, making sure that we're in the best position that we can to attract and utilize those funds. So I mean, part of what we do is, you know, we kind of survey the landscape here and say, hey, you know, opiate money is coming down the track here. So, you know, we started, you know, working on preparing ourselves to be really attractive to receive those funds. It's not that we're trying to just chase money here, but, you know, when there's a certain area that's got attention and there's a potential benefit of bringing those funds into our community, we're trying to position ourselves to be really competitive and take advantage of those funds. And so this is another area that's coming and that we can try to help, you know, anticipate or collect data or prepare for receiving those funds if they're not just applied, you know, based on a population formula, if there's some competition related to that. How do we show that, you know, we're ready to receive and utilize those funds? So if you have any questions on the budget, you want to sit down and talk about it, I just wanted you to have a chance to see it at the department level before it went to the county executive level. But
Either we cut expenses or we raise revenue. When the last, have we ever, comprehensive look, and maybe we don't have that many fees. That, of when we raise our fees and how much in that, and like I say, we may only have a very few, but that's what you have to raise your expenses 4%, your revenue, a combination.
yeah, I mean, our largest fee revenue source is our sanitarian program. And we analyze those fees every single year. We estimate what our revenues are gonna be. And we take a look at what our license fees are and adjust them accordingly. We have not raised our fees in the past couple of years for our licensed establishments because of the pandemic. And, you know, it will be coming with an adjustment for next year. So early next year, we will have an adjustment to those fees to reflect actual costs. But we do analyze and assess those and discuss that every single year.
Moving on to COVID-19 and the tax response.
Yeah, so this is just an opportunity to kind of bring you up to speed as to where we're at with what's happening with COVID-19. Big picture pieces are, you know, we're maintaining a workforce that helps supplement our existing workforce for responding to the pandemic. We are continue to operate or assure that there is testing available for COVID-19 in multiple locations within the county. That antigen tests are available for the general public at no fee. That we have vaccination clinics available. Shelley really runs our testing and vaccination sites in terms of the planning. Our staff and contractors work to staff those or fill in staffing for those. We intend to stay with Sunnyview as a vaccination and testing site as long as we can. We're probably one of the most stable sites in Northeast Wisconsin in terms of the accessibility of testing and vaccine. Our staff have worked tremendously hard to assure that we have provided vaccine in the community, at school sites, at church sites, at other community sites to try to make vaccine more accessible and meet people where they're at and where they're comfortable. Kelly might have some numbers for you, but I mean, it's staggering the number of clinics that we've
357.
357 vaccination clinics have been run by the health department or planned or put into place by the health department. So that's the beginning of the pandemic.
Since we were J1, we were able to vaccinate, this is us. This is not the Culver Center where we got free running, we're talking with them, or Fox Valley, it was us. So, whether it's a hallway in a church or a school gymnasium, we were in 357 different times.
How busy is the Sunnyview now?
It varies. We are seeing a real wait and time moment for that next bivalent vaccine to come. You're hearing that daily, that people are holding until that new vaccine comes. So our numbers have gone down some for the booster crowd. But the new people, the littles, they're coming in. So they're asking lots of really good questions. And if I could have you guys sit at vaccine clinic, it would be, the questions are really pointed. People really want to know what we're doing. We're really able to educate the community at the level of questions that they're asking. Staff is incredibly involved. They train constantly and update their information. So we are the gold standard in the region as far as I'm concerned. If people look to us, they ask us questions all the time.
And so we plan to continue those sites, especially the anchor sites, like Sunnyview. As Shelley just mentioned, we're expecting a bivalent vaccine to be released in September next month. That will be available for persons aged 12 and up. We know that we have significant shortfalls in vaccine uptake in the younger age groups, so it's not going to help the under 12. And you know, we'll likely see, you know, some impact from that as school starts, just with those lower vaccine rates. I mean, it is estimated that 95+% of the population is either vaccinated or infected. So, I mean, this is pretty much, I mean, it's really run through, you know, our communities, although the new variants are creating reinfections for individuals, and we can help people not become reinfected by giving them boosters or this new bivalent vaccine. You know, that's a personal choice. And, you know, we'll be seeing more information coming out about long COVID. The numbers of people that have COVID and have just these lingering health issues for long periods of time, for weeks and months or longer, from a COVID infection. All the more reason to try to help people from becoming infected in the first place.
And there's studies showing cumulative damage. So you get COVID once, you get COVID twice. By the time you get it the third time, the damage in that particular area might be not repairable.
Lots more information to come and things that we'll learn, but we will continue to, you know, utilize the resources made available to us to, you know, try to help assure or provide, you know, testing and vaccine and information. You know, we're continuing, you know, our data surveillance, pushing information out to the community about the current status of the pandemic and our updates. Surging through the fantastic job for us and helping us share that data. And then on the monkeypox
Can I
front,
ask one?
yes.
Do we see the pandemic ever turning into an endemic?
We see that, it's unlikely that coronavirus will go away, especially, you know, with its ability to mutate. As the population of persons infected becomes smaller, the rate of change will decrease. Because really every infection is an opportunity for some kind of recombination or a variant to develop. And so, you know, right now with this being worldwide and lots of new infections still occurring, I mean, in the United States alone, we're looking at 100,000 new infections a day. And those are ones that are measured or tested, and we're only anticipating that 10% or so of the actual infections are identified. So we still have large numbers of people becoming infected just in the United States. Once we can bring that down, we'll see less variability. It's very likely that this coronavirus, much like other circulating coronaviruses like common cold, will become a part of viruses that we see, you know, continually, and it's certainly not out of the question that you know, this coronavirus or another variant of this coronavirus will be a part of a future vaccine, maybe even a combination vaccine with flu. We would hope at that point, as things settle out, we'll see a bit more of a seasonality to this as it originated as a primarily respiratory virus, but now it's still respiratory and transmitted respiratorily, but seemingly other impacts on health. But due to the nature of transmission, it's still likely to evolve into some sort of a seasonal respiratory virus.
Do we reimburse, for again, specifically on paternity, do we reimburse for leaving these sites?
So, we do, we're able to use our funding to, pay for the operation of that site, so we are paying Sunnyview, for use of the facility. And then it's either our staffing or contracted staffing.
Okay.
that we bring in. So, we've also been able to do some equipment upgrades out there just to help facilitate, the use of that site for this purpose. On the monkeypox front, we've had, maybe I heard Melissa give this update, we've had one, so we've had 2 confirmed cases in Winnebago County. One was in Menasha, back in, June, I believe, June. And we've had one here recently in Winnebago County. We've also had exposures, from cases in Appleton within Winnebago County that we've followed up on, so we've had a number of contacts, low risk contacts that we followed up on. We've had a handful of other suspect cases of monkeypox. In other words, their symptoms are enough like monkeypox that we wanted to have them evaluated and tested for monkeypox, which right now is a swab of a lesion sent to the state lab or a commercial lab, and then waiting for that result, which takes a few days. Monkeypox is primarily spread through really close contact, through direct contact with lesions or, lesion material that is, on, bedding or other materials. Scabs remain highly infectious, materials. So, cleaning up after is critical. But it's not super transmissible unless you have really close contact. And by really close contact, meaning that you're right in someone's breathing zone for a long period of time. You are having direct contact with the pustules, or you're having sex with someone that's infected, and it may have, those lesions, in the anus or in the groin area or in the mouth. And that can also exacerbate it being spread respiratorily. So, so far, so good. We've had, just the one confirmed case. We're, pouring resource into, we just had our first vaccine clinic this week. Right now, we're only able to use vaccine to treat post-exposure cases, not pre-exposure. So in other words, if you've had if you're a close contact to a case, if you have multiple sex partners, and monkeypox is a part of that, or you attended an event. Those are the general criteria right now, so that you have some reason to believe you've had an exposure. We want to get you vaccinated to help prevent spread. Ideally, what we want to do is vaccinate persons that are at high risk of exposure based on what their activities are, who around them has it or doesn't have it. So we'll continue to work on that. We were allocated 10 doses of vaccine, which now, because of an emergency use authorization, we were able to turn into up to 50 doses, 5 doses per vial. Challenge is each of those 1 dose vials that can be turned into 5 doses. Once that is open, it has to be used within 8 hours.
And we actually got the second doses to those vials, so we actually have 100 doses.
Oh, excellent. Thank you for that update. And so, yeah, it's just, it's the next crisis on the horizon. We doing more work up front can help an explosion on the back end. We're seeing this we're over 10,000 cases in the United States. The cities and locations that have been impacted, we're seeing a lot of growth. I think week over week, we just saw a 20% increase nationally in cases. And so in places where monkeypox has taken hold and is infected, a larger number of individuals, we are seeing rapid growth. What we want to do is everything we can to prevent us getting to that stage of that, uncontrolled exponential growth of a virus like we saw with coronavirus, with COVID-19. The things that are on our side, of course, is that it's much more difficult to transmit. It's a lot easier to assess your risk. You're not going to get it walking down the street, going to the grocery store. And so if people understand what their level of risk is, they can take precautions to do that. Not everyone will. We have a vaccine already, which we never had with COVID. So the opportunities to really knock this down or prevent it from taking hold here or there, we just need to be diligent and aggressive in how we apply those measures now. So it may sound like an overreaction, but you're really trying to prevent, an explosion of cases once you reach a critical threshold.
I have a quick question. I appreciated the communication from the health department that was sort of sent out as a press release. One of the things that was in that was related to events where monkeypox is present, and I was a little confused on like what those events would look like, and as far as sort of events to avoid. Do you have any kind of guidance on what an event surrounding monkeypox would be?
Well, let's say we had, somebody travel to an event where we find out that monkeypox was being spread at, and we had a person that attended that event. We would want to offer vaccine to that person within that 14-day window after that event, ideally as early as possible. We're going to continue to offer some form of vaccine clinic weekly. What we did for our very first clinic was only notify healthcare professionals because we really wanted those people that are currently waiting for vaccine. We wanted to make sure that we wanted to get them in as quickly as possible for the future. And this was our first run. We wanted to see what the response was going to be like and have our staff prepared for running larger clinics. Fortunately, we didn't have a lot of demand. How many did we do? Two. So we'll continue to make it available, but right now, because we're only vaccinating after a suspect exposure, it's likely that many of these vaccines will occur outside of clinic time. We've partnered with our surrounding jurisdictions to assess what capacity they have. And in order to utilize the limited amount of vaccine that we have, when we have a case that needs vaccination, we're talking so that, we don't just pull one dose out of a 5-dose vial and have to throw the rest away. If Appleton's given a dose and we've got somebody that needs one, we can send them to them or they can send to us. So we're just right now, while vaccine is limited, and because we want to get to that point of offering it pre-exposure, we want to be judicious with how we utilize that vaccine. Anything you guys want to add? So we are tracking our time separately. We don't know if funding will be available or if the existing funding that we have for COVID can be utilized for the monkeypox response. But we'll track that just in case.
We will move on to the healthy lifespan division overview.
Yes.
Yay, that's me. We have been sitting for a long time. Feel free to stand up, move around as you need to do this. I know that we are way over time, so I unfortunately am going to condense this and go through it quickly. But the biggest part is that you understand I am here. I will answer questions. The staff in this division have been around for years and they're very experienced. They're great at what they do. We can help you find the answers that you need about the certain work that we do. So healthy lifespan, really cradle to grave. We cover the entire lifespan. We help young babies, old folks, everything in between. We kind of think of ourselves in 3 teams. There's 9 people in this division. I should start by saying I'm a Lana Banana, if you can remember. My background is I have a master's in public health from UW La Crosse. And I came over to Winnebago because it was the only local health department in the state that was hiring a communication specialist outside of Milwaukee or Dane. And I was really interested in that aspect of public health. So I came over here 6.5 years ago as a communication specialist. I got to learn the entire department, all the different staff, and even better, all the other departments outside of public health. So I've worked a lot with human services, emergency management, the sheriff's department, and I feel like we're getting places. So currently I support the Healthy Lifespan Division, and that has nurses in it. It has the Well Women program in it, and then it has community health strategists as well. So we really try to bring in a variety of skill sets to target our work. When you think about public health, there's 2 concepts. There's that direct individual. Public health is usually thinking about the environment. So we always use this, this situation of the frog in the pond. We care about the frog, but overall, we're trying to make the pond better. Because rather than fixing each frog at a time, we gotta make the pond better so the frogs aren't continuously getting sick. So I'll continue to bring up that thought frame. So with the family child health team, when we're thinking about that individual, what we do is we help moms, pregnant moms, fathers, primary caregivers, anyone who is around a young child. We have done a lot of data in our county. We know that kids are not ready to go to school. This was exacerbated during the pandemic. They weren't really hitting those developmental milestones that they're working on. So our nurses can serve as a safety gap. If there's someone that needs, direct intervention or help with breastfeeding, that transition home from the hospital, they need a car seat. All those different things is what they call the health department for. We try to refer them on to a long-term solution, get them on something that their insurance can cover, set them up with human services, long-term care support if there's a disability or a specific need. But our health department is the experts that can get in there right away, assess, and then connect them to what they need. Some of the main kind of concepts we cover for children and families, developmental screenings. We have a lot of funding right now that's putting data into a system across Winnebago County and the Fox Valley showing our kids hitting the milestones they're supposed to be at, developmentally, communicating, motor systems, all those things. We also do a lot of basic needs help. So if this child needs a safe place to sleep, we want to pack and play in that home to make sure it's not just a couch or, whatever is available. So we will hand out, we will help educate parents and get them to a place where they're making sure the environment is as best it can be. Lead education and investigation, any screening that comes from a doctor's office or our own WIC program that's over 3.5, we reach out to the family, do a lot of education, and sometimes there's also an environmental screening where we go into the home and try to look for some of those cues of why the child has been repeatedly exposed to lead. Breastfeeding support, big opportunity for us here to make long-term impact that's cost-effective for all. So those are the big direct service concepts that we work on. As far as how we work on the environment for family child health, we are part of coalitions that are regional wide, they're county wide. We work very closely with human services. Birth to 3 is a program helping families learn and make the best opportunities for their family. We try to advocate for young families learning what's best for them and their child and how they can get there in the space that they are. We also, on the flip side, looking at the older range, promoting healthy aging. So we have nurses that will go into homes, assess for falls risk, help with medication setup. Sometimes it's an advocacy issue, and an older adult needs help with their will or whatnot. We can find those referral sources. The ADRC at Human Services has so many opportunities for people to get help. And it's about spreading that message, having all of our staff know what's out there and get people connected as soon as possible. Doug had mentioned, it's almost a full-time FTE that we provide to the Housing Authority. The Housing Authority has 7 locations that our nurses actually go to and help these residents, because we found over plenty of years that it's actually more helpful just to have a nurse on call that can help these people navigate their life, navigate the health resources that are in our community, and stop those issues before they become crises, because it's always easier to be preventive. We also do a lot of advisory for long-term care facilities, as Melissa can attend to through the pandemic. They are calling us, they're calling our nurses, asking, what should we be doing here? How can we best serve our residents? On the larger scope of promoting healthy aging and the larger pond that we work on, falls prevention is really a local initiative as well as a state. It's our biggest cost barrier to repeated falls. So we partner with the fire department, the police department. We do education for staff, and then we also do education for individuals. There's funding that's come in there. We've provided falls kits. We've set up app referrals so that people automatically, every time there's a fall that happens, get sent to Human Services for a screening. If they need our nurses to come in, we follow up. So that's a definitely strong partnership. We call that coalition finding balance together. And they're really bringing in some system-wide change to that whole process. We also talk about access to healthcare in our division, and mostly this comes around the Well Woman program, but also we promote signing up for insurance in the fall. If people are not sure how to find insurance, they fall into that gap. We can help refer them to partnership or other areas, other cars, that kind of stuff. So we're helping people find healthcare before things become a crisis. The Well Women program specifically, so this is kind of unique. When we did the merger around 2012, that's when Well Women came into Winnebago, correct?
Sorry, which point?
2012 with the merger, or was it 2010?
No, actually, Bowman changed public health, when, or that Scott Walker defunded.
The defunding.
Yeah.
Yeah, Title 10. So it was 2010 or 2012-ish. So as you can see in this map, our Well Woman program actually services 9 counties. We're not just Winnebago. So this also helps those coordinators make great relationships with all the healthcare systems in the region. They know the providers, they know the billing systems, and they know the partners at other local health departments. So it's a good partnership. This is Rick and Jenny for the Well Women program. If you're not familiar with it, it's a basic screening program for women to identify cancer. So pap smears, breast cancer screenings, and then trying to find the follow-up treatment. There's no cost to participants. It is probably utilized, our base right now, if we have 350 or so enrollees a year, about 80% are Hispanic folks. So non-English speakers, either oftentimes rural as well. So that is where the program is most utilized. And
So who runs this program? And then if I'm understanding correctly, does whoever runs this program for us has to serve all those counties are located? They're
Yeah.
listed, right?
I know, they're amazing. And so these two, Jenny and Marissa, and the funds come through the Department of Health Services. The Well Woman program is funded by our state. And what they do is 9 counties, we mostly get people enrolled by referral. So if a doctor sees someone and says, you know what, I think I want to make sure you're doing these extra screenings. That is the most common way people are enrolled, is by a referral, but they can self-refer, or we have partners that would call up and say, hey, can you get someone onto your program? That is bilingual with Spanish, and yeah, calls come in, they probably enroll 10 to 20 people a week. It's efficient, it's great. Biggest hang up with this program is billing. everything would work smoothly if hospital building systems could just get over that glitch. Because unfortunately, with the language barrier, people will get bills, they don't understand, they thought it was a free service, and then it's just. But go working on it. I wanted to throw up this to just show how much the current organization, the staff in this division work with. We've got national representation on, advisory boards for suicide death review. Currently, Teresa's working with the state of Wisconsin on a legislative committee that she was asked to be part of. The ADRC has asked us to serve at so many of their events. Just on Tuesday, we did their open house and we were there, and the experience in this division, which besides Marissa, I'm the newest person in this division and I've been here for 7 years. There's so much experience, so much relationships, so much community building in this division that I've learned is invaluable. And so that's kind of where I'm gonna end this today. There's 3 core teams, but really our staff, because they're nursing, they help out with CD. When it came to COVID, all the nurses were displaced for vaccines and they still are continuing to be. We also have a unique role in that half of our staff are in NENA all the time. So that helps bridge that gap. And then the experience, over 190 years between the 9 staff that have been served for the Winnebago County Health Department. So with that, I'm gonna pass around my business card. You can call me, you can email me, you can ask questions. I can give presentations on specific programs that we do to help you guys understand what we're trying to get at. I know that we're all here because we want to help the community. And I thank you guys for serving because it's hard. And it's as we can tell, like the learning curve is going to be great for all of us. The more that you ask me questions, the more I can help you understand my role and how you want to help our community and how I can help our community. These are some flyers. Please take a few if you go to churches or libraries or schools. We are offering these parent resource hours as a transition into not having nurses readily available. Our nurses, when they have to go to clinics, when they needed for this communicable disease response, we're suddenly limited with how many families we can help. So we've set up twice a month, once in NENA, once in Oshkosh, to provide resources for families to come in. They can connect with each other and they can also connect with multiple professions. So it's not just a nurse, it can be breastfeeding support, it can be a peer, we can talk about substance use, anything that they need to in that one spot. I've just written a very substantial grant that was submitted on Monday, over $400,000 worth from the Department of Health Services, and it would be over 2 years. And there's an interview next week that we're going to talk about it a little bit more, and I'll be able to keep you updated on that. But that funding would come in and move this into schools, into boys and girls clubs, into places where families and kids already are. They don't have to come see us. We go to them. We help them find the resources they need in our community and get caught back up. COVID was really detrimental to our youngs, and they're not ready to go to school. We need to do some extra focused time and get them caught up.
Do we have that fund or we apply for that grant?
I applied for that. We applied for that grant. Thank you very much. Everybody here helped me so much on Monday. And I got word yesterday that we have an interview next week. So that's where it is. There's no promise, there's no guarantee, but it's exciting.
And also, I just want to point also, if the second Monday, if you're ever available, Alana is at every ARC meeting. She always gives the updates. She's one of the highlights. So the second Monday of every month.
Yeah,
3 o'clock.
winning.
Nice. This job.
Thank you. You've taken enough of your time, but appreciate it.
Thank you, Lana. We will try to end these meetings by 9:30. I think although like the county board.
Hey.
We
I think it's fact. We spent, and Permian County Board, we were there until 4 hours on Tuesday, so yeah.
Yeah, we're finding our way back to that. And, but we will strive to do that in the future so that you can schedule appropriately. But we'll try to keep these meetings in 2 hours. Thank you.
So our next meeting would be
Yeah, I don't have, anything that I think is gonna be pressing pending for next month right now. So I mean, we could go to October. Um,
I already have it on my calendar for the 21st.
Yeah.
October.
Yes.
Well, he's like, it's the numbers.
Yeah, I mean, it's up to the board. I mean, if you guys wanna meet, we can, I mean, I wanna be respectful of your time, and if we're not gonna have an action item that you have to vote on. Wanna offer that opportunity to skip a meeting. We'll try not to go more than 1 month without a meeting. And we'll always try to incorporate some educational portion to that meeting. If we wanna schedule a meeting just for a little more education and briefings for you guys, we can certainly plan to meet next month and do that. But I don't know that there'll be something that we're gonna need you to take action. So, you know, these first few meetings, in this term have gone a little longer. It's your meeting, so I leave it to you to decide what you'd like.
I don't mind when we meet with Madam Chairman, but like Doug, it's over the years. I just need advance notice because I have to ask off. And, I need I need at least 2 weeks notice. So I have no problem missing a month or after 2 months, but I do want to know when we're gonna have one so I can ask off. That's my only thing that happens in the future.
What do you think of this?
Not having such a meeting.
Are you both okay with
Yeah.
that? Bobby?
So, yeah, so we'll meet in October.
I'll try to get as much information as I can in those.
It's your new goal, right?
I'll
So,
be hanging around all year.
yeah, we like that. We will plan not to meet in September, but we will meet October 21st.
Yes.
Any Board of Health reports?
I was very short, I got reappointed to Naples Healthy County Advisory Board. Anyone can apply to it. Their meetings, they have 2 national ones, the annual conference in Westfield, but they have monthly call meetings. Anyone can apply, you just get to the state association. It's very much what you learn about here.
Any other comments? Or is there a motion to adjourn?
So move, Madam Chairman.
Second,
That was really quick, Mike.
all in
I think
favor?
he's ready to get out of here.
Aye.
And thank you for being here, and we will see you on October 20th. Yeah. Okay.
Oh, yeah. Oh, yeah.
Doug, you need my signature on the transfer?
Yeah, I do, I guess.